Well, I'll go ahead and get us started. Thank you so much for joining us today. I'm Dr. Leah Jeanette, and I'm here with Dr. Sana Loue, and we're going to be talking about focusing on health policy. It's one of our concentrations in our Masters of Arts in Bioethics and Medical Humanities here at Case Western Reserve University. So just a little bit about myself. So I'm the director of our MA in Bioethics and Medical Humanities program. I'm also an alum of the program. I graduated in 2009. So I feel like I have great perspective of both the student side and now the administrative side. I'm also the associate director of research. I didn't even update my own bio on here. The associate director of research of educational programs and a senior research associate here in the Department of Bioethics. And I'm also a clinical ethicist at University Hospitals. It's one of our four teaching hospitals here in Cleveland. Dr. Loue, I'm going to let you introduce yourself and you can give a little bit more, I think, about your background and how it connects to health policy, which would be
Okay,
really helpful.
thank you. So I'm a professor in the Department of Bioethics. When I first came to Case Western Reserve University to the medical school, my original appointment was in what was then called epidemiology and biostatistics and is now called quantitative health sciences, population and quantitative health sciences. When I first came, my focus was primarily on HIV research, both quantitative and qualitative, as well as mixed methods, and also family violence. And in 2012, I moved my primary appointment over to bioethics, and it has been great. I still have appointments in population and quantitative health sciences, in the Department of Psychiatry, in the Center for Global Health, and also at our School of Social Work. I serve as the director of the health policy concentration, as Dr. Jeanette mentioned. And my background, I think, I love the policy concentration because it lets me bring everything in my background together. So my undergraduate work was in social work, and I did community organization at that time. Um, I have two PhDs, one in epidemiology and one in medical anthropology. And I have a variety of master's degrees, one in education, one in public health, one in theology, one in social work, and one in history. So what I do in bioethics with my research and with the IRB and with NIMH, I chair a data safety monitoring board for NIMH, and as a clinical ethicist at University Hospital, at the regional hospitals. It lets me bring everything together. And as we talk about the policy concentration, you'll see how it really draws from multiple domains of interest and how the students who have gone through that concentration really have very diverse interests and go in very diverse directions quite successfully. So it's really exciting.
Well, thank you for sharing. So just a quick agenda for us. I'm going to talk just a little bit briefly about our School of Medicine, which is where our Department of Bioethics is located at Case Western Reserve. We'll give an overview of the MA program, and then we'll focus on the health policy concentration. We'll close our time with application process deadlines, student citizenships and financial aid, and we will leave time for Q&A as well. So speaking of Q&A, there is a feature here on Zoom, if you are live with us, where you can submit a question. We'll save them till the end, and then either myself or Dr. Loue will be able to answer those. If you are watching us, the recording of this, please feel free to submit a question to us, bioethics@case.edu. I'll repeat the email address at the end of our presentation as well, but we'd love to hear from you if you're watching our recording as well. So as I mentioned, our Department of Bioethics is located in the School of Medicine of Case Western Reserve. I think it's important to highlight that, yes, we do have medical education. We have master's and PhD programs in our School of Medicine. We also do quite a bit of research. And Dr. Loue actually has done quite a bit of research herself, and so has had impact on these different rankings with her work that she's done over the years. But I think what's really incredible, and it speaks to what Dr. Loue was talking about earlier, of this interdisciplinary approach. And we really do partner with folks across the university. So in the School of Law, in the social work school, in other departments, but also our hospital partners. And so it makes Cleveland and Northeast Ohio and Case Western Reserve, a really robust research institution. And it means our students are getting to learn from those who are doing the work, which I think is really exciting. So, kind of moving us forward, I think one of the questions that often comes up about bioethics and medical humanities, and I would even say more specifically about health policy, is why study it? And I think ultimately healthcare impacts all of us, whether it's personally or professionally. And for most of our students, it's a professional interaction, but it's always going to impact every single one of us personally as well. But we do see constant advancements and changes in medicine, science, technology, and policies that lead to big questions. These are ethical questions. Now, this is not the only questions, but I think one of the big ones that we think about, especially when it comes to the health policy concentration, is what kind of values should inform policy and practice. I think it's a really challenging question, and I think the answers are ever changing and ever growing. And Dr. Liu will be able to speak to that a little bit more when we talk specifically in our concentration on how we think about discussing health policy. Ultimately, students that do our master's program really get an interprofessional and multidisciplinary education. Dr. Liu alone has many different areas of expertise, but in addition, other faculty in our department also have different fields of study. And we really are able to come together in our program to give this robust education. Ultimately, it does launch our students into their professional careers. There's a lot of directions our students go. And later on, I'll have Dr. Liu share more specifically about students who have done the health policy concentration. But we have students who go on to clinical and legal professions, arts and humanities. I'm an example of someone who went full time into bioethics and specifically clinical ethics. And we always have a segment of students who are looking for discernment. So they have this idea that they want to be in healthcare or they want to be in health policy or they want to work in research, but they're not exactly sure what the right career path is for them. And so this program allows them a lot of exposure to different types of jobs and career opportunities to really think through and discern what might be the best fit for them. So moving on to our master's program, just to kind of give a highlight, we are celebrating our 30th year of the master's program this fall. We're one of the oldest master's in bioethics and medical humanities programs in the country. Students who complete the program full time, it takes 1 year or 2 semesters. One of the hallmarks of our program is our customized curriculum. And so while we are a 30 credit hour program, 13 and a half of those are pure electives. And within the curriculum, you can also choose from 3 concentrations. We have 160 hours of clinical rotations and our short-term study abroad. We also do personalized advising for our students and dual degree. If you're interested in learning more about dual degree, contact us and I can give you much more detail on the specific programs. So just to highlight our clinical ethics rotations, this is an opportunity for students to rotate in our hospitals here in Cleveland. Some students do the 160 hours, so 2 semesters of rotations. Those in the health policy concentration or the research ethics concentration do 80 hours of rotations in the fall. And then, as we'll talk about in a little bit, 80 hours of practicum in the spring. But in these rotations, our goal is to get students both depth and breadth of experience in our hospitals and to think about the different interactions with the providers, the clinicians, the allied health professionals, policies from an ethics perspective. So extracting what are the ethical issues that are at the heart of what they're discussing. We do offer short-term study abroad courses. And in fact, Dr. Liu just led a course that went to Paris, France over spring break. These can count as a 3 credit elective for our program. Dr. Liu, do you want to say something really quick about your Paris course?
I would love to. I think the course was wildly successful with the students. We had a nice combination of undergraduate and graduate students. Um, and the course focused really on looking at the interest of issues arising at the intersection of religion and culture and bioethics, with a focus on um, how the United States and how France define and perceive otherness, and the implications of that for the healthcare systems and for access to healthcare. We met with academics, we met with clinical ethicists, we had a tour of the Old Jewish Quarter. The students went to different museums for a bioethics activity. We went to the Immigration Museum, and I think for the most part, everyone had a great time exploring Paris and really had a wonderful time with the course. This would actually be really appropriate for students who are interested in the policy concentration, because we're looking what the course focuses on, and we may shift the focus for next year. But what we really do is look at um, the practical implications in terms of healthcare, but we also look at higher level policies and how those are formulated and how they trickle down into affecting patients and providers and hospitals within the US system and within the French system. So I think if folks are interested in traveling overseas, I think the Paris course fits in really well with the policy concentration.
I heard great things from our students about this course. And another course, the Granada, Spain, is
Mhm.
actually happening right now. So Dr. Mark Alicio is leading a group of students in Granada as they learn and focus on a different topic. I think it's a great illustration of ways that we think beyond the walls that we have here in our department, but also kind of just getting used to almost this idea that um, we are teaching you in this program one lens of bioethics and medical humanities, and other countries have and other societies have different approaches. And it's really important to understand that it's not that one is right or wrong, but there's a difference of value, a difference of history. And I think the Paris course is a great illustration of
Yeah,
that.
I would agree.
So, as I mentioned before, our program has three concentrations. So, by default, all of our students are in what we call the traditional program, meaning we have the required courses, and then all the electives are open to what students are interested in taking as it relates to the program. We then have medicine, society, and culture, research ethics, and health policy as our three concentrations. And I know this slide can be a little overwhelming, but what I like to point out is everyone's taking Foundations 1 and Foundations 2. Everyone's doing a one semester of clinical rotations, and everyone does the capstone. And then from there is where we have the variety. So if you look specifically at the health policy, we can talk more about those courses. So Dr. Loue, you kind of conceptualized this concentration. And while I have some information on the screen, I'd love for you to talk more specifically of what is the purpose of this concentration? What do you think attracts students to it in kind of the creation and how it's being run and kind of the focus
Mhm.
of it?
So the concentration really focuses on understanding how policy is formulated and how we evaluate policy. And if I think of all of the different students that have come to it, they've had very diverse interests, and they go in very diverse directions when they're finished. So for instance, some of the graduates of the MA in bioethics who did the policy concentration, some have gone on to medical school, some have gone on to PhD programs, primarily I think in related to animal science and neuroscience. A few have gone on to pharmacy and are getting their degrees in pharmacy and are following through with fellowships. One is going into dental school. And I know one is taking 1 or 2 gap years to do research in a lab. And what they all said that they loved about the policy concentration is it helped them understand how they could pivot from their primary focus, whether it was medicine, whether it was a dental career, whether it was a career in pharmaceutics, and really effectuate change in that domain. So the first course, and I think you're going to have them up at some point, but the first course, which is the fall course, it's a 1.5 credit course, and it focuses on what is policy? How is it developed? And we look at different perspectives on how policy is developed, and then different perspectives on how policy is analyzed and evaluated for its success or lack thereof. We have guest speakers, amazing guest speakers. So we have an attorney who does one of the presentations, a social worker who convinced the Philadelphia City Council to pass amazing legislation. We have a physician from Iran who does a session with us talking about how he was able to effectuate change within Iran and with the World Health Organization. And I'm also on a working group of the World Health Organization developing guidance on clinical ethics consultations. In the spring, we have two courses. The first is a case studies of health policy, and this really reaches across domains. And we look at how policy is formulated and developed in different arenas. And people, when they think of health policy, right, they think of, oh, we're talking about Medicaid or Medicare or insurance, or what is the hospital doing to me, right? Or maybe physician communication, right? But what I think many people don't realize is that embedded in laws and policies relating to areas we would never think of, they have implications for health access, and for bioethics. So for instance, we look at the built environment, we look at the larger global environment, like with research in the Arctic. We look at housing, we look at research-related policy related to animals and to human participants. This year, we looked at adoption and how that relates to health policy and bioethics, and had a world-renowned researcher speak to the class. We look at end-of-life care. We look at conscience clauses. So we look at welfare legislation. We look at immigration legislation. People don't think that immigration relates to health, and particularly health of people who aren't immigrants, but it does. And so we look at that. The health policy, now anybody can take the formulation and analysis of healthcare and the case studies course, but you must be in the concentration to take the health policy practicum, because the other two courses are co-requisites or prerequisites. And for the practicum, people have done independent research to really enlarge their expertise in a particular area, or they can be placed with an entity and have 80 hours that way. So people have done research with the case IRB and have actually helped develop university-wide policy that has been rolled out to all investigators in the university. One semester, a student was particularly interested in reproductive health. And so she had her hours with one of the faculty members at the law school, who is known for her litigation efforts in the context of reproductive health. So there are all kinds of opportunities with this. You can tell I'm really excited about it. And one of the activities that the students do is at the end of the case studies, they are required to identify an issue of particular concern to them and identify a legislator or an official who has responsibility in that arena and compose a letter to them, either in support of or disagreeing with some piece of legislation that they have either supported or opposed, with a rationale for why. And so they develop actual practical skills that will help them move forward with policy initiatives that they're interested in. one semester, instead of writing a letter, people had to write a letter to the newspaper and see if it would get published. So there are all kinds of opportunities.
I always love hearing Dr. Loue speak about the concentration because I feel like every time I hear her talk more about this, I learn something new. And so I love the excitement and the passion behind it. But you're also going to get that in the class with Dr. Loue, which I think is really incredible. So um, I just wanted to mention some program outcomes, and Dr. Loue actually gave some examples of where our students have gone on to that have done this concentration. But I will add a couple more things. So, in addition to the knowledge and the skills that they're building in these classes, we have additional skills and knowledge that are going to help you stand out as you move through the next phase of your career path. Um, Dr. Loue, I think one of the things you said, which it is a skill, and it's learning how to write a letter of
Yes,
advocacy or
yes.
concern to an official. And I think learning that skill set takes time. And so the fact that the students get to do that in a really safe way with guidance, I think is fantastic. Um, for some students that are looking to go on to medical school, perhaps, and maybe be advocates and change makers through their medical career. Our master's program is looked upon by the AAMC as an application enhancer. And just anecdotally, we hear from our students every year that when they get interviews for medical schools, their questions are often directed about the master's program and the work they're doing and what they're learning. And so students can talk about what they've learned in their health policy courses
And
and
I've
things.
actually had several students in some of my courses who have gone on to publish their work that they did in my courses. And they've told me that that helped them really stand out when they did interviews with medical schools.
And ultimately, I mentioned discernment before, but we also have networking opportunities with our alum. Just the alum that Dr. Loue has referenced, they would love to talk to current students about what they got out of this program, what the work they're doing. There was actually, we just celebrated commencement and graduation last week. And actually, one of the things that was said by our director of education, Dr. Anderson, really stood out to me. And we curated a list of all the different topics that students wrote about for their capstone. And she encouraged them to say to the students that now you know who's an expert in these different topics. And I think the same thing is true. If you know that fellow students are doing a concentration, they are becoming experts in that concentration, and they will also be resources for you as in addition to the faculty and staff. I think that's such a beautiful thing to think about of once our students are graduated and they've become alums, they are now colleagues and experts in their own right. So if you're interested in submitting a master's application, we are still taking applications for this upcoming fall. The final deadline is August 1st. We are an in-person program, so I highly encourage you to submit your applications as soon as possible so that we can review and render a decision, and then you can work on, if you don't live in Cleveland, Ohio, to move here. And we can always help with resources regarding housing. Um, we have student assistantship opportunities. The deadline has closed for this, but if you do have interest in learning more, please let me know. And we also have a fantastic financial aid office here on campus that can help answer those questions. So as I mentioned, we're doing rolling admission. Our final deadline is August 1st. And it's hard to believe I'm already starting to plan orientation for August, and the first day of classes this fall will be August 25th. So if you have questions for us, we'd love to take them. I see that there was a question submitted and it's specific to a student, and so I'll just answer that by typing to them. But Dr. Loue, I think one of the questions we consistently get is how or what makes our program stand out from other masters in bioethics or medical humanities programs?
I think it's the diversity of faculty backgrounds and the diversity of courses that are offered and the opportunities that we offer. So we have four clinical affiliate hospitals that people can do their rotations with. Um, as you mentioned, everyone on the faculty comes from a different background. So mine is sort of all over the place with law and social work and education and theology and history, but we have other folks who come from philosophy. We have other folks that come from more data-driven sciences. We have other folks who come from education, from anthropology. So, and all of those perspectives really go into the formulation of our curriculum and into the course materials themselves. So I think all of that actually helps us stand out. I see that there's a question in the Q&A about how can students tailor their coursework and experiences to explore the intersection of faith and healthcare. So if you don't mind, I'd love
Yeah,
to respond to that.
I think you're a
So
perfect person to respond.
so I think that can be done in a number of ways. So I rotate a course. I offer it every other year on religion, society, and bioethics. So that's one way that someone can explore the intersection of bioethics and religion and how religious beliefs affect both policy and individual health behavior and access. Someone can also explore that area in the context of their capstone, regardless of whether they're in a concentration or not. And certainly when we talk about policy, for instance, the conscience clauses. So that was one of the areas we explored in the case studies class. But then one of my students who was not in the policy concentration did a capstone that specifically focused on on conscience clauses and the intersection of policy, bioethics, and how religion drove those conscience clauses and the implications for both, well, for patients and providers and healthcare institutions. So I think there are so many different ways if that is someone's area of interest. And they're also free to take electives in our religious studies department. That would be another way of fostering that interest.
I will add one other thing, and that is when you're in your clinical ethics rotations, a lot of the sites will require you to actually rotate with a chaplain as they go meet with patients. And so you're also going to get to see the applied side of this, not just the theory in the classroom, but what it looks like in the healthcare setting and what that means for the patients and how the chaplain interacts with them. But it also in your weekly preceptor meetings where you're reflecting on your observations and your rotations for the past week, you could have those discussions of, I saw how faith and healthcare interacted, or how it impacted patient care or decisions. And so we also see it in our rotations as well.
Yeah, and at UH, the head of the palliative care program is a chaplain. So there's the chaplain, but then there's the head of the palliative care program who happens to be a chaplain. So
Yeah.
yeah, so there are lots of different ways.
Well, I'm not seeing any more questions, so I'll go ahead and wrap up our time. I just want to say, Dr. Loue, thank you so much for joining us and talking about the health policy concentration.
Sure,
I think it's
my
a
pleasure.
fantastic opportunity for students to really hone in more, specifically on an area of interest for them. For those who are attending, if you're or watching the recording, we have other Zoom meeting or Zoom webinars coming up in the coming weeks. But you're welcome to schedule a one-on-one Zoom meeting with me to talk more about your interest in the program, application questions, and I'm always happy to connect you with other faculty as well to talk about your interests. And also schedule a visit with us. We are still here throughout the summer, although it is a little quieter, but we'd love to have you come and visit. So, um,
And if I could add, if anyone has particular questions that come to them after the webinar about the policy concentration, they can feel free to connect with me as well. Be happy to respond to those.
that'd be great. So if you have any further questions, email us at bioethics@case.edu. I'm the one who checks that email, and I promise we keep up with it. And so we can make sure that you get the answers and the connection and the resources that you need. We hope that you consider submitting an application for this upcoming fall. And thank you so much for your time, Dr. Loue.
Thank you.
All right. I hope everyone has a good rest of their day.
Bye, everyone.